All right, good morning. We're here for the Health and Human Services Committee hearing this morning
To assess Larry's mental health.
regarding Board Bill 117. Mr. Clerk, will you call the roll to make sure we have a quorum?
Alderwoman Hubbard, Alderwoman Green,
She's excused.
Alderwoman Spencer,
Present.
Alderman Gunther,
Here.
Alderwoman Martin,
Present.
Alderwoman Navarro,
Excused.
Alderwoman Middlebrook,
Present.
Alderwoman Rice,
Present.
Chairman Arnowitz,
Present.
President Reed. You have 6 present, Mr. Chairman.
Having a quorum, we can move forward. We have today with us Mr. Dave Sikora from the Health Department.
Human Services Department.
I know. We got that slash line on there. But anyway, he's gonna explain to us about Board Bill 117, which is authorizing us to be able to accept a grant on behalf of the Association of Area on Aging, I believe it is. So Dave, can you explain to us exactly what it is and the
Sure.
amount of monies?
Sure. This is a contract with the Missouri State Association of Area Agencies on Aging, of which we're a part. And it's a subcontract that they're working on a contract from a company called PCHP, which is in connection with Anthem. This National Association of Area Agencies on Aging has a partnership with this group to do essentially visits and case management assessments for Anthem commercial clients. And the reason we're entering into this, and the area agencies across the country have entered into this work, is because, as you're aware, all the discretionary funding at the state and the federal level is pretty much getting dry. It's going to be dry. It's dried up. It's level funding. As I mentioned the last time I was here, we don't expect to see any increases. So one of the things that we are doing is getting into the business arena of this in order to bring monies in to pay for those services that we need. And this is essentially a Medicare billing issue. So what will happen is one of our persons who does the work will go out, get a referral from Anthem, go and try to set up an appointment with a client with the idea of finding out, you know, you're a member of our thing, but we don't have any record of you attending the doctor in 18 months. And, or, you know, you were taking your meds, but there haven't been any meds billing. So is there issues of you not being able to get to the doctor? Is there something that, some reason why you can't do this, you know, and then do a little assessment of the client. That information gets put into a system run by this company, PCHP, which then Anthem bills to Medicare. And it's a Medicare billing that they do. They're returning the money after this company takes their cut. The Area Agency on Aging State Association is taking a 10% cut, and then the rest of the money comes down to us. And if you saw if you looked at the documentation there, you see that, like, if you meet these milestones, it's like $371, you know, to complete a visit. So bottom line is, if we can go on and do this work, we can bring in money. And in this case, we're looking this year, we're going to be starting slow. We don't expect to have a full amount, but we should be bringing in about $30,000, which then, after we pay our contractor, we'll have money that we can pay staff or whatever. It's essentially designed to get our foot in the door, because this is the wave of the future in the social services community-based programs, working with hospitals and insurance companies to kind of solve those issues that will prevent somebody from going back into the hospital. Insurance company pays thousands of dollars for that. They'd rather pay a couple $100 to us to go on and assess a client and do that. So this is a first year. It's essentially a pilot for us across the state to see if this works. We see it as a revenue opportunity, and it also identifies clients that we might normally see. We'll be aware of our services when we go out there.
And this will also be would also help, like, the senior citizens at home that need some kind of changing their house to keep helping
Well,
them as a fall
that was, I was
program?
telling you about a WashU program.
Oh,
that's
okay,
where-
that's the WashU.
The example I was given, WashU occupational therapy program is working with Anthem, with Humana right now for them to do falls prevention assessments. So somebody who's been billed in the hospital for a fall, they can go out, do an assessment, determine maybe they need grab bars, maybe the rugs need to be changed, what's a thing that will prevent them falling again, which then prevents the hospital expenses
Hospital
and thing.
expenses.
So this is the wave of the future. The insurance companies, the hospitals are looking for ways to meet their STAR requirements, that they call them. And this is working with the community-based organizations is one way, and we're hoping that it'll bring money to us in the future. This year, we're doing it as a very low cost. We only asked for $30,000. We're gonna be contracting with one of our providers to do this, and they're going to, in order to do the things they're gonna have to do, they're gonna get the bulk of our contracting dollars, but we'll have revenue for our staff time and admin costs, et cetera. And then we've told them that after this coming year, we'll sit down and see how it worked, and across the state, we'll negotiate with the company and see what's going on, so.
Okay. Well, thank you, Mr. Sikora. I'll go around the table here if any committee members have any questions. Alderwoman Spencer?
Thank you, Mr. Chairman. So the $30,000 a year just seems like somewhat of a small amount.
It is. It's based on billing of clients. First off, we don't know how many people in the city of St. Louis are part of the Anthem Commercial Care Program.
Okay, so
So-
do we have any, what the Anthem Commercial Care Program is a program, how do people get it? How do people
Anthem, it's like Anthem has Medicare Advantage programs.
It's a
and
supplemental.
It's a supplemental program
To
to them,
It's a program that's supplemental to what?
to their insurance, Anthem's.
Any insurance, or is it just Medicare?
Health insurance, their
All
health
their
insurance.
insurance
program.
programs,
Yes,
individual and group?
Right, and we've been told there's about, 2,200 clients they have in Missouri.
200,000?
2,000 to 2,200
Statewide?
statewide, and so we're not anticipating a big
Okay.
influx here in the city, which is why, and statewide, we're doing this on a pilot thing. We've asked them not to send us a whole lot. We're trying to get our foot in the door, see if this works, because there's a lot of things that you have to do. If you went through and saw the scope of work,
Yeah.
you're required to set up appointments, you gotta visit them, you try to get an assessment, you gotta do this, you got 30 days to this. If a person's in the hospital, you gotta visit them within 3 days, you gotta do it. I mean, there's a lot of work, but if you get it done, and a lot of people, apparently it's, in 2 other states or 3 other states are already doing this, and some of the people we've talked to say, well, you get a couple that reject you, but most people talk to you and you get this, and then Anthem is able to bill Medicare and they pay you. So we're hoping as a pilot to make this thing work.
So, do you know if Anthem covers the whole state of Missouri?
They cover almost all of it except the far northwest, like
Okay.
Kansas City, Albany area. They have a few clients, but really not that far. I don't think I have my map with me.
So it's just sort of extrapolating, if we've got 2,000 patients statewide,
They send us
maybe
a,
5 to 10% of that would be 150 people here in the city?
well, yeah, and I don't even think it's that much because
Okay.
of our population. I mean, the commercial care programs I just don't think we have a whole lot of those people. They send a county breakout or a regional breakout, and we figure that the majority of them are actually in St. Louis County,
Okay.
St. Charles County area as opposed to us. They kind of, everybody lumps St. Louis, they say, but based on the referrals that have come in over the last 2 weeks, the bulk are in the county, and I think we've gotten about, I don't want to, I'll say 12, I think it's actually 20, but I'll say we got 12 referrals to start looking at over the next 30 days.
And who are the staff members that are gonna?
We're
actually go out?
contracting with St. Andrews Senior Solutions. They're one of our contractors that do all of our case management program. And they have staff who have worked in the past through their home health and other things with insurance companies. And so they're a little more familiar with doing this.
Okay.
I'll have a staff person that'll kind of oversee get the referrals out, get the bill, and make sure we turn our report in, but for right now, for this year, I don't have the staff to do
Sure.
the work,
So the city of St. Louis isn't actually gonna be going out there and doing this work, making sure that the patients are doing all the.
We have a contractor who's gonna take care of that for us.
So, for a lack of a better, for my understanding, the city is sort of a middleman here in a way?
Yeah.
Just kind of taking in the funds and then.
It's the way our agency works for most of all of our funding comes in. We're a contract agent. I have
Okay.
very few people who direct service. I have one case manager, I have an information assistant staff that takes phone calls every day, and I have a home repair guy who kind of runs my volunteer program. Everything else we do, we contract out. I have 24 contractors for my
Okay.
home delivered meal program, my transportation, my legal services. All of these services and this is in the realm of a case management, in-home assessment thing, so that's who we utilize is those contractors who have already
Gotcha.
bid for services with us and are contracting with us.
And are all those contracts issued through like an RFP process? or-
Yes,
okay.
we do that. We did that in this past November. A year ago, in November of 17 is when we put out the RFP. They turned in their RFPs in January. We awarded contracts in April, on April 1st. Went through the whole E&A process, and on July 1st, which is our fiscal year, we started with all of our contracts.
Gotcha.
And we do that every 3 years. It's a 1-year contract and 2 one-year extensions for that.
Are there other opportunities with other providers, other than Anthem, for example?
We're hoping.
Okay, so
That's the
this
whole
is
purpose of doing this, is all the
Okay.
AAAs across the state and
Gotcha.
are looking to, this is something different than we normally do. We don't, we're not delivering meals, so we're taking the step. We're hoping that this is successful because we see other opportunities down the road for this.
Are there other cities in the state of Missouri that are participating in something like this?
Yeah, all the other AAAs in the state. There are 10 area agencies in the state. We're the only one that's an actual city area agency.
Okay.
Like the area agency that's in the county has St. Charles County, St. Louis County, Jefferson County, and Franklin County.
Okay.
And so that area agency has a contract with MA4 to
Okay.
do this
To
for
do this
those.
Why is the city separate from that? If that is a consortium of areas, and we are just a tiny little 300,000
This
population.
goes back to 1970, when the early 70s, when the Older Americans Act was set up, and St. Louis had 800,000 people in here, and we were like,
Okay,
the city was the city, and
we said, no, thank you.
we didn't share with the county, so the city was awarded an area agency on
Okay.
aging to get the funds, and we have worked to keep that way all of this time.
And is there any collaboration with the county
Oh, yeah,
organization?
we work together on
Okay.
everything, yeah.
On
Well,
all
this whole collaboration, the state association, we work together with all 10 area agencies.
So the city is kind of the anomaly out of those 10 groups that's not currently doing this? Is that
No,
accurate?
okay, this just started this year.
Okay.
September 4th with our state association started this on September 4th with Anthem, with the
Gotcha.
Anthem group.
Okay. So
We're
all
one
these-
of the area agencies that's subcontracting with them. With MA4, we're subcontracting. Because of our process, we're going through this issue here to get, board approval for this so that we can go on and be part of this group. But the other 9 area agencies are already working under this.
Okay, I know this is just a simple contract. This is just fascinating. I didn't realize that we were kind of embarking in all this stuff. So I appreciate the committee
I'm offering again,
indulging my
invite me and I'll give you the
questions.
whole, we could sit here for hours talking about this stuff. Question?
No, Kara asked me, or Alderman Spencer.
All right, that's all I had. Thank you.
Okay,
Mr.
thank
Chairman.
you. Alderman Gunther?
Did I think so?
Yeah, the alternate will move from the 20th, I think got most of it there, but just really quick here, so $30,000 is for your contract to provide these services, which will be subcontracted out minus the 10%, so essentially there's about $3,000 that the city's gonna
Right.
come in, so do you
This
feel
year.
that? so
Yeah,
that-
this is fine, yeah, we're doing this so we get our feet on the, we wanna be a partner with the rest of the state. We wanna get our feet on the ground, see how this thing works. And we've told our provider that's gonna be doing this that after this year and everything, we said, then we'll renegotiate everything on how we're gonna do it. But I don't have the staff to go out and try to do this stuff. they're comfortable with going ahead and doing it, and so we said, look, if you'll take this on and start working the issues and doing this, then that'll give us some experience and some idea, because we don't even know, Medicare billing apparently is a real zoo anyway.
Yeah.
So we're having to figure out how that's gonna all occur and when we're gonna get our monies and how that's gonna be dispersed, et cetera. So it's a brand new thing for us. We've never done this with a commercial entity, and it's the wave of the future though across the country, so. There
So
are some,
since it is just a one-year contract, then if you reevaluate going into next year and you're like, oh, well, the time that we put into it, we need
Right.
15%
Right.
or something that you
Right.
can
Exactly.
renegotiate. Okay,
exactly.
right. No further questions.
Thank you. Alderwoman Martin?
No questions.
Okay. Alderwoman Middlebrook?
No questions.
Alderwoman Annie Rex?
No questions.
No question. I think Kara took the bulk
Yeah.
of asking all the great
Apologize,
questions.
sorry, guys.
No, that's great,
good
that's
information.
great. So, after hearing, the contents on Board Bill 117, entertain a motion for recommendation for a due pass out of
I
committee.
move that we pass Board Bill 117 with a due pass recommendation.
Second.
Hearing a due pass in a second, Mr. Clerk, would you please call the roll?
Alderwoman Hubbard, Alderwoman Green, Alderwoman Spencer,
Aye.
Alderman Gunther,
Aye.
Alderwoman Martin,
Aye.
Alderwoman Navarro, Alderwoman Middlebrook,
Aye.
Alderwoman Rice,
Aye.
Chairman Arnowitz,
Aye.
President Reed. You have 6 aye votes, Mr. Chairman.
Thank you, thank you. We passed out Board Bill 117. I want to thank everybody for showing up today. Sorry we got a late start.
Can I take one more minute? Can I interrupt?
You
One
can
more
take
minute?
5 minutes. if
No,
you
no,
want.
at the
That's all you
last
got.
meeting, you all asked me a question. At the
Oh,
last meeting,
yes,
I
yes.
could not provide an answer to.
You said you'd bring some.
This is a list, it's got our benefits program, the senior tax bill that you passed out of committee last time. It's in order to start some new sites, and so the last page of that is the sites that we already have, and you can see the new ones that are highlighted there.
Right.
The top sheet, you can reproduce and pass out to everybody you want. The sheet that's the last sheet, that's the form itself, is our staff form, but it gives you an idea of the services that we can help people get. We can do a lot more, but this is the services and the amount of dollars that conceivably these people could apply for. So when we're asked for that senior tax money, it's to start 3 more sites to do this. And what the people need to do, they shouldn't go to the site, they call, make an appointment, and pick the nearest site. So if you want to pass this out and let people know, this is what we do, and
Wonderful.
I couldn't give you the information the last time, but that's all of it right there.
That's great. Great, thank you.
Well,
Actually,
thank you,
passed my
Mr.
email.
Clerk,
thank
we
you.
appreciate it.
Yeah.
So with that being said, go
Sure.
ahead, Sarah.
Oh, no, sorry, go ahead.
Go ahead.
No, I just asking if you had a
Go
card. We're good.
That being said, I entertain a motion for the Health Committee to dismiss.
I move that the health committee dismisses
I second it.
the due dismiss recommendation.
The due dismiss.
Thank you, everybody.
All right.